Medical workers in China are fighting a battle for the world, in some cases without adequate protection. More than 1,700 nurses and doctors have so far been infected. Several have died.
Many of them look so exhausted in front of the camera. And when you're exhausted, you will get infected because you just lost your alertness and you cannot follow the guidelines well.
Last week, the Chinese government conceded there was a shortage of essential medical equipment, including protective clothing. But state TV says that's changing now. It's been showing pictures of army medical teams arriving at the epicenter with specialist gear. Further proof, says China, of its intensifying efforts to control the virus. A virus that the country's foreign minister says has created excessive alarm among some governments.
Winter will pass and the spring is sure to come. China's vigorous and thorough measures are paying off. The epidemic has posed a severe challenge to China's economic and social development. Nonetheless, the difficulties will be temporary and short-lived.
The latest official figures from China's National Health Commission offer a crumb of comfort. These latest figures don't show a significant drop in the death rate, but the number of new infections in Hubei province is falling. They were half what they were on Thursday. But experts outside China urge caution, saying these figures can't be independently verified. Analysts say it's become a pivotal moment for China's leader, Xi Jinping.
If this works and it looks like this thing is contained and they get, thumbs up from the World Health Organization and other, epidemiologists, it's going to look like they've done the right thing and he could come out of this looking well. But at the moment, it's touch or go.
On Saturday, China's government extended its quarantine restrictions to the capital, Beijing. Anyone returning to the city following the extended Lunar New Year holiday must now isolate themselves at home for 14 days. State media says those who don't will be punished, without specifying what that will mean. In Hong Kong, the infection rate is under 60, with 1 dead. Now the chief executive, Carrie Lam, says the government is to spend more than $4 billion of taxpayers' money helping workers affected by the virus. She says around 200,000 low-income families will be given a one-off grant of more than $600 each. But there's no help yet for many small to medium-sized businesses, which are reeling from the effects of this public health emergency. Adrian, Al Jazeera, Hong Kong.